Understanding type 2 diabetes. Diabetes is a chronic medical condition in which sugar, or glucose, levels build up in your bloodstream. The hormone insulin helps move the glucose from your blood into your cells, where it's used for energy. In type 2 diabetes, your body's cells aren't able to respond to insulin as well as they should. In later stages of the disease, your body may also not produce enough insulin. Uncontrolled type 2 diabetes can lead to chronically high blood glucose levels, causing several symptoms and potentially leading to serious complications. Symptoms of type 2 diabetes. In type 2 diabetes, your body isn't able to effectively use insulin to bring glucose into your cells. This causes your body to rely on alternative energy sources in your tissues, muscles, and organs. This is a chain reaction that can cause a variety of symptoms. Type 2 diabetes can develop slowly. The symptoms may be mild and easy to dismiss at first. The early symptoms may include constant hunger, a lack of energy, fatigue, weight loss, excessive thirst, frequent urination, dry mouth, itchy skin, blurry vision. As the disease progresses, the symptoms become more severe and potentially dangerous. If your blood glucose levels have been high for a long time, the symptoms can include yeast infections, slow healing, cuts or sores, dark patches on your skin, a condition known as acanthosis nigricans, foot pain, feelings of numbness in your extremities, or neuropathy. If you have 2 or more of these symptoms, you should see your doctor. Without treatment, diabetes can become life-threatening. Discover other symptoms of type 2 diabetes. Causes of type 2 diabetes. Insulin is a naturally occurring hormone. Your pancreas produces it and releases it when you eat. Insulin helps transport glucose from your bloodstream to cells throughout your body, where it's used for energy. If you have type 2 diabetes, your body becomes resistant to insulin. Your body is no longer using the hormone efficiently. This forces your pancreas to work harder to make more insulin. Over time, this can damage cells in your pancreas. Eventually, your pancreas may not be able to produce any insulin. If you don't produce enough insulin, or if your body doesn't use it efficiently, glucose builds up in your bloodstream. This leaves your body's cells starved for energy. Doctors don't know exactly what triggers this series of events. It may have to do with cell dysfunction in the pancreas or with cell signaling and regulation. In some people, the liver produces too much glucose. There may be a genetic predisposition to developing type 2 diabetes. There's definitely a genetic predisposition to obesity, which increases the risk of insulin resistance and diabetes. There could also be an environmental trigger. Treatment for type 2 diabetes. You can effectively manage type 2 diabetes. Your doctor will tell you how often you should check your blood glucose levels. The goal is to stay within a specific range. Follow these tips to manage type 2 diabetes. Include foods rich in fiber and healthy carbohydrates in your diet. Eating fruits, vegetables, and whole grains will help keep your blood glucose levels steady. Eat at regular intervals. Only eat until you're full. Control your weight and keep your heart healthy. That means keeping refined carbohydrates, sweets, and animal fats to a minimum. Get about half an hour of aerobic activity daily to help keep your heart healthy. Exercise helps to control blood glucose, too. Your doctor will explain how to recognize the early symptoms of blood sugar that's too high or too low and what to do in each situation. They'll also help you learn which foods are healthy and which foods aren't. Not everyone with type 2 diabetes needs to use insulin. If you do, it's because your pancreas isn't making enough insulin on its own. It's crucial that you take insulin as directed. There are other prescription medications that may help as well. Medications for type 2 diabetes. In some cases, lifestyle changes are enough to keep type 2 diabetes under control. If not, there are several medications that may help. Some of these medications are metformin, which can lower your blood glucose levels and improve how your body responds to insulin. It's the preferred treatment for most people with type 2 diabetes. Sulfonylureas, which are oral medications that help your body make more insulin. Meglitinides, which are fast-acting, short-duration medications that stimulate your pancreas to release more insulin. Thiazolidinediones, which make your body more sensitive to insulin. Dipeptidyl peptidase 4 inhibitors, which are milder medications that help reduce blood blood glucose levels. Glucagon-like peptide-1 (GLP-1) receptor agonists, which slow digestion and improve blood glucose levels. Sodium glucose (COTRANSPORTER2) SGLT2 inhibitors, which help prevent the kidneys from reabsorbing glucose into the blood and sending it out in your urine. Each of these medications can cause side effects. It may take some time to find the best medication or combination of medications to treat your diabetes. If your blood pressure or cholesterol levels are a problem, you may need medications to address those needs as well. If your body can't make enough insulin, you may need insulin therapy. You may only need a long-acting injection you can take at night, or you may need to take insulin several times per day. Diet for type 2 diabetes. Diet is an important tool to keep your heart healthy and blood glucose levels within a safe and healthy range. It doesn't have to be complicated or unpleasant. The diet recommended for people with type 2 diabetes is the same diet just about everyone should follow. It boils down to a few key actions. Eat meals and snacks on schedule. Choose a variety of foods that are high in nutrients and low in empty calories. Be careful not to overeat. Read food labels closely. Foods and beverages to avoid. There are certain foods and beverages that you should limit or avoid entirely. These include foods heavy in saturated or trans fats, organ meats, such as beef or liver, processed meats, shellfish, margarine and shortening, baked goods such as white bread, bagels, processed snacks, sugary drinks, including fruit juices, high-fat dairy products, pasta or white rice. Skipping salty foods and fried foods is also recommended. Check out this list of other foods and drinks to steer clear of if you have diabetes. Foods to choose. Healthy carbohydrates can provide you with fiber. The options include whole fruits, non-starchy vegetables, legumes, such as beans, whole grains such as oats or quinoa, sweet potatoes. Foods with heart-healthy omega-3 fatty acids include tuna, sardines, salmon, mackerel, halibut, cod, flax seeds. You can get healthy monounsaturated and polyunsaturated fats from a number of foods, including oils, such as olive oil, canola oil, and peanut oil. Nuts, such as almonds, pecans, and walnuts. Avocados. Although these options for healthy fats are good for you, they're also high in calories. Moderation is key. Opting for low-fat dairy products will also keep your fat intake under control. Discover more diabetes-friendly foods, from cinnamon to shirataki noodles. Risk factors for type 2 diabetes. We may not understand the exact causes of type 2 diabetes, but we do know that certain factors can put you at increased risk. Certain factors are out of your control. Your risk is greater if you have a brother, sister, or parent who has type 2 diabetes. You can develop type 2 diabetes at any age, but your risk increases as you get older. Your risk is particularly high once you reach 45 years old. African Americans, Hispanic Americans, Asian Americans, Pacific Islanders, and Native Americans, American Indians and Alaska Natives are at higher risk than Caucasians. Women who have a condition called polycystic ovarian syndrome (PCOS) are at increased risk. You may be able to change these factors. Being overweight means that you have more fatty tissue, which makes your cells more resistant to insulin. Extra fat in the abdomen increases your risk more than extra fat in the hips and thighs. Your risk increases if you have a sedentary lifestyle. Regular exercise uses up glucose and helps your cells respond better to insulin. Eating a lot of junk foods or eating too much wreaks havoc on your blood glucose levels. You're also at increased risk if you've had gestational diabetes or prediabetes, two conditions caused by elevated glucose levels. Learn more about the factors that can increase your risk for diabetes. Receiving a type 2 diabetes diagnosis. Whether or not you have prediabetes, you should see your doctor right away if you have the symptoms of diabetes. Your doctor can get a lot of information from blood work. Diagnostic testing may include the following: hemoglobin A1C test. This test measures average blood glucose levels for the previous 2 or 3 months. You don't need to fast for this test, and your doctor can diagnose you based on the results. It's also called a glycosylated hemoglobin test. Fasting plasma glucose test. This test measures how much glucose is in your plasma. You may need to fast for 8 hours before having it. Oral glucose tolerance test. During this test, your blood is drawn 3 times before, 1 hour after, and 2 hours after you drink a dose of glucose. The test results show how well your body deals with glucose before and after the drink. If you have diabetes, your doctor will provide you with information about how to manage the disease, including how to monitor blood glucose levels on your own, dietary recommendations, physical activity recommendations, information about any medications that you need. You may need to see an endocrinologist who specializes in the treatment of diabetes. You'll probably need to visit your doctor more often at first to make sure your treatment plan is working. If you don't already have an endocrinologist, the Healthline Find Care tool can help you find a physician in your area. Early diagnosis is key to proper diabetes management. Find out more about how type 2 diabetes is diagnosed. Tips for how to prevent type 2 diabetes. You can't always prevent type 2 diabetes. There's nothing you can do about your genetics, ethnicity, or age. However, a few lifestyle tweaks can help delay or even prevent the onset of type 2 diabetes, whether or not you have diabetes. Risk factors such as prediabetes. Diet. Your diet should limit sugar and refined carbohydrates and replace them with low glycemic whole grains, carbohydrates, and fiber. Lean meat, poultry, or fish provide protein. You also need heart-healthy omega-3 fatty acids from certain kinds of fish, monounsaturated fats, and polyunsaturated fats. Dairy products should be low in fat. It's not only what you eat, but also how much you eat that matters. You should be careful about portion sizes and try to eat meals at about the same time every day. Exercise. Type 2 diabetes is associated with inactivity. Getting 30 minutes of aerobic exercise every day can improve your overall health. Try to add in extra movement throughout the day, too. Weight management. You're more likely to develop type 2 diabetes if you're overweight. Eating a healthy, balanced diet and getting daily exercise should help you keep your weight under control. If those changes aren't working, your doctor can make some recommendations for losing weight safely. The bottom line: these changes in diet, exercise, and weight management work together to help keep your blood glucose levels within the ideal range all day long. Discover how curcumin, vitamin D, and even coffee can also help you prevent type 2 diabetes. Complications associated with type 2 diabetes. For many people, type 2 diabetes can be effectively managed. If not properly managed, it can affect virtually all of your organs and lead to serious complications, including skin problems, such as bacterial or fungal infections, nerve damage, or neuropathy, which can cause a loss of sensation or numbness and tingling in your extremities, as well as digestive issues, such as vomiting, diarrhea, and constipation. Poor circulation to the feet, which makes it hard for your feet to heal when you have a cut or an infection, and can also lead to gangrene and loss of the foot or leg. Hearing impairment, retinal damage, or retinopathy, and eye damage, which can cause deteriorating vision, glaucoma, and cataracts. Cardiovascular diseases such as high blood pressure, narrowing of the arteries, angina, heart attack, and stroke. Hypoglycemia. Hypoglycemia can occur when your blood sugar is low. The symptoms can include shakiness, dizziness, and difficulty speaking. You can usually remedy this by having a quick fix, food or beverage, such as fruit juice, a soft drink, or a hard candy. Hyperglycemia. Hyperglycemia can happen when blood sugar is high. It's typically characterized by frequent urination and increased thirst. Exercising can help lower your blood glucose level. Thank you for watching the video. Don't forget to like our video, subscribe to our channel, and share your opinion in the comment section. Please click the link in the description